Hey, welcome back. It's a lovely Thursday evening here on The Closest. Hope everything is going well in your world, and Happy New Year. If we missed anybody over the last week or so, happy to be joined now, our MU Health Care segment. We do this once a month now that the football season is done, but Dr. Sebastien Lalonde joining us from MU Health. He is an orthopedic surgeon specializing in hands and also microvascular surgery. So with all of that, welcome aboard and Happy New Year to you, sir.
Thanks, George. Thanks for having me.
All right. The hand. Is there any other part of the body we take more for granted than the hand?
Probably the eyes, perhaps, okay. but the hand is really is one we take for granted for sure.
Well, and your specialty is hand. I mean, what are some of the things that you encounter? I mean, most people are aware, oh man, he lost a thumb, he lost a finger, or part of a finger. But beyond that, what are some of the things that you encounter as a hand specialist?
Well, the interesting thing about hand surgery is that, different from other fields in orthopedics, the hand is pretty complex organ, so you have to deal with anything from arthritis to vascular or blood vessel-related problems, nerve problems, tendon problems, so it really goes through different organ systems, so pretty intricate part of the body, and that's why they have a whole specialty dedicated to it.
And so you spend a lot of time with what looks like most people would think be the jeweler's loop in front of you. And I kind of jokingly said that, and you chuckle a little bit, but just in the last 5 years, it seems like hand surgery and the microvascular aspect of things have come so far. What are some of the couple of things that really have stood out to you in your field?
Well, I mean, it's true that definitely over the last few decades we've gotten better and better at the microsurgery aspects of things. So, being able to diagnose and treat things and deal with blood vessels that are sometimes so small that you can't really see them all that well, except if you're under a microscope. So things that in the past we used to just avoid treating, now we have a lot of things that we can do. In fact, microsurgery has been around for a while. The newer stuff in the field now is really looking at ways that we can improve on some surgeries that we've been doing for trauma, for arthritis, basically getting people moving quicker, so basically shorting the rehab.
Okay, and with hand trauma, and I talked to you about this off the air, but I went to the MU Health website at muhealth.org, and I just typed in your name. I was like, all right, we'll see what some of the is he doing some research? What's going on? And the first thing that pops up is the Centralia Craftsman returns to workshop after innovative surgery saves thumb. Two things on that one. One, obviously it was a trauma, and secondly, innovative procedure. So walk us through a little bit about that. Was that something that could have been done just a couple of years ago?
Yeah, I think so. It's just I think what's helpful to know is that here in Columbia we're lucky to be in a place where we have specialized hand surgery, and being in a level 1 center. It's not that the surgery was particularly new. It's just that it was there and available for the patient, whereas he was coming from a center that initially was saying that he would lose his thumb. So it wasn't so much that the surgery was novel, it's that we had the tools and ability to get him back to work actually much quicker than we anticipated. And I think that, and I know that the article highlights the surgery itself, but really what I wanted it to highlight was just how lucky we are to have the hand therapy service that we do at MU, because this person who initially thought he was losing his thumb, which is 30% of your hand function, was back to doing woodworking in a month to 6 weeks, which is just phenomenal.
Yeah, and again, you can just go to muhealth.org and you can read the story about this. It's not his first trip, by the way, to the ER as a woodworker. As anybody who's been a woodworker is well aware of that one. Hand trauma, though, what are, obviously we can go through and we can spend the next 30 minutes talking about hand trauma, but what are some of the basics on that? What defines hand trauma, and what are some of the simple things that we can do to make your job easier?
Well, I think, people hurt their hands in many different ways, right? I mean, it could be that you're in the kitchen cutting, avocados, which is a pretty risky activity in my opinion. or you could be out in the field playing football. Basically, people get minor cuts and scrapes on a regular basis. I think what's important with hand trauma is just being able to know when something is actually wrong, like listening to what your hand is telling you. If you have an injury but your hand becomes numb, or you have an injury and certain functions don't work anymore, you can't move your finger, or if it's been 3-4 days and the swelling stays, and the finger's crooked or not moving, these are things that would warrant further a look.
Okay, well, and then how do we? You mentioned listening to it, but in a case where a lot of people think, well, okay, you find the tip of the thumb, you pack it nice, and you head off to the ER. Is that the best thing?
No. So, I mean, there's certain things that can indicate when you've had, minor trauma. You'll know in the first few minutes if it gets really swollen or not.
Right.
I mean, a lot of times rest, ice, elevation, anti-inflammatories can be helpful. Really what you're looking at is the trend. Oftentimes people will have a jammed finger, but a jammed finger can be either a small kind of ligament problem, or it can be a broken bone or a joint dislocation that has some issues to it that if it's not necessarily identified, it could be a problem if it's delayed. So what I would tell people, because I get a lot of times, family members or patients of mine who have family members that call me and say, hey, is this something that needs to be looked at? I usually will tell them, if 2-3 days go by, you're able to make a fist, the swelling goes away, that's fine. If a few days goes by, you're still having difficulty, the hand's still swollen, that's when we'd be happy to come and look at you.
Dr. Sebastien Lalonde with us at MU Health, orthopedic surgeon specializing in hand and also microvascular surgery. And with that, you talk about arthritis. What are some of the simple things that we can do to just make sure our hands are in good shape? Because you work out to keep the rest of you in shape, but it's your hand that's lifting the weight, it's your hand that's pulling the resistance band. So how do we keep that hand in shape?
Right. Well, I mean, I think for people with arthritis often will come and say that, there's certain activities that they used to love to do that they have difficulty, mostly because of pain or stiffness. A very common place to get arthritis in the hand is at the base of the thumb. And like I said, if there's anything to highlight is how important the thumb is to everything that you do, and people often will take it for granted. When you do have arthritis, when you have a problem with your hand, it's just really important to keep it in motion. There's no specific activities or working out, but that being said, you want to be able to know when there's something that shouldn't be the case. There's a lot of things that we can do to help with arthritis of the hand, and it doesn't mean that you necessarily have to come in and get a surgery with us. There's a lot of times where, we can get a proper diagnosis, help you with a splint, help you with some activities or exercises. All these things are guided treatment, but I guess what's important is, if there's something that's really bothering you and it's really affecting your quality of life, and you can't do certain things you want to do, please come in. We'll give you peace of mind. We'll have a look at everything. Yeah,
and most parents are familiar with the index finger curl, so that at least keeps the index finger in shape for a lot of people. Dr. Sebastien Lalonde with us here on the close. Again, you can find out more information at muhealth.org. And again, it's a really cool article, so just Google Dr. Sebastien Lalonde, and it talked about the Centralia Craftsman and a really innovative surgery. It was a really cool read. So it was kind of cool that was the first thing that popped up. Anything else on the way out? Because hand rehab, you mentioned the hand rehabilitation specialists that are there. What are some of the things that are different now that get people back to regular motion?
Well, thanks for asking that, George. So this is really where it's been going on the last few years, is that a lot of the techniques we used to use for arthritis surgery when we would do joint replacements, or for ligament surgeries when we fix ligament problems and dislocations, we used to have to put people in a cast for about 6 weeks to heal. Now, with some of the newer methods we actually have the technology to be able to put a little brace inside the hand called an internal brace. And that, I think, has really changed the way we look at certain things where, I'm not putting people in casts for 6 weeks after arthritis surgery. I'm not putting people in casts for 6 weeks after a ligament procedure. We're actually allowing them to move at time one, and that early motion after surgery is so critical. Or the early motion after injury is so critical, because the hand, unlike anywhere else in the body, doesn't tolerate immobilization well. If you put a hand in a cast, it's going to be stiff, and it's going to need even more rehab after.
Yeah, because I had actually had a son who had a trauma, cut the tendon and on the index finger, and that was in one of those braces for a while. But then he had to work with the rubber bands, which were glued to his fingernail. It was get in there, get it taken care of, and get right started on that rehab. Dr. Sebastien Lalonde, MU Health. You can find more online at muhealth.org. MOI's phone number is 882-BONE. Easy enough to remember. Just remember the 882 and then all the things that you normally break. Your bone. So there you go. That gets you squared away. Dr. Lalonde, thank you for the time, sir, today. I really do appreciate it. I hope you don't have to stay terribly busy, but it sounds like what you're doing, a lot of steps have been taken forward, so people are really benefiting. So thank you.
Thanks for having me.
The Closers on KFRU and KLIK.